I'm Dr. Sara Mucowski, one of the physicians at Dallas IVF, and I want to discuss the role of laparoscopy in your fertility treatment. A majority of patients undergoing an infertility evaluation will never require surgery. But if your Dallas IVF physician is suspicious that you have an anatomical issue that may prevent you from conceiving, a laparoscopy may be recommended. Laparoscopy is considered a minimally invasive surgical procedure where an instrument termed a laparoscope is placed into the abdominal cavity through a very small incision. The incision is often made within the belly button where a scar cannot be seen. A camera is then attached to the laparoscope, whereby we can directly visualize your pelvic structures and determine if there are any anatomical factors present that may be impairing fertility. Those anatomical issues will then be surgically corrected during the same procedure with surgical instruments placed through one or two other small incisions. A normal diagnostic laparoscopy entails inspection of the abdominal cavity, specifically looking at the female reproductive organs. Here, we can see a normal appearing uterus, normal appearing right fallopian tube and right ovary, as well as normal left fallopian tube and ovary. In addition, the posterior abdominal wall and anterior abdominal wall, with bladder, all appear normal. If damage to the fallopian tubes is suspected, you may undergo an additional procedure called chromotubation or chromopertubation at the time of laparoscopy. Chromopertubation involves using a catheter to inject dye into the uterus and ultimately to the fallopian tubes. This is similar to the hysterosalpingogram, or HSG, when radiocontrast is injected under X-ray visualization. When the tubes are open, the dye easily spills from the tubes into the abdomen. Here you can see dye emerge from the right tube as well as copious spill from the left tube. In women with damaged fallopian tubes, the tubes may dilate but not spill any dye due to blockage. In severe cases, the ends of the fallopian tubes are scarred together and the tubes become very swollen and inflamed. This is called a hydrosalpinx, and its presence decreases pregnancy rates and increases the risk of having a tubal ectopic pregnancy. As a result, when hydrosalpinges are present, removal of the damaged fallopian tubes may be recommended in order to improve the chances of having a successful pregnancy. The physicians at Dallas IVF have enormous experience in performing laparoscopies. Collectively, we have performed several thousand procedures. Here at Dallas IVF, we are happy to offer laparoscopy to our patients in our own fully licensed and accredited ambulatory surgery center and at several of the area hospitals where we are on staff.